Hello, everyone. I'm really excited to be here. And some of you have heard the story of School District of Osceola County, and really a hero story about how they have changed the way they're providing healthcare for their employees. But I have really updated information here. So even if you've heard this before, I think you'll find this to be of value today, and we're excited to be with you. In October of 2019, I was approached to do a claims data analysis for School District of Osceola County. What had happened was their employees' wage increase was completely wiped out by the increase in their Cigna premium. And so the teachers union went to the school board and said something's got to give. These employees are paying a significant percentage of their income for a premium for a health plan that they can't use. Their deductible was in the range of $4,000. Even above that, they were having to pay a co-insurance up to about $6,000. So they were paying maybe 40, 50% of their care up to that $6,000. And, for school bus drivers and janitors and teachers and people, who are taking care of our kids, this was just not a good situation. Morale was low. Their near site clinic was in a hospital system. We know the cost of care in a hospital system, all the way through the episode of care, is 5 times higher than that's with an independent clinic or physician. And the school district knew it was not doing its fiduciary duty. They had a duty to make sure that the healthcare dollars were being spent wisely, and they were not being at that point in time. And so the school district had to make some quick changes and eventually made some major changes. The quick changes that they made was, number one, to get the near site clinic out of a hospital system and over to Harris Rosen's Rosen Health Center. More than 2 decades ago, Harris Rosen changed the way he was providing healthcare for his employees. He kept Blue Cross Blue Shield out the door and built his own health center and his own health plan, and saved so much money that I think it's in the range of $450 million. He's given that savings back to his community and provided his employees' kids with college educations. It's just an amazing story. But meanwhile, he heard of this problem and offered his health center to these employees. And so the School District of Osceola County Health Center moved over to the Rosen Clinic. And that was at zero out of pocket now for the employees. But the other thing that they knew was that, imaging exams were so expensive in those health systems that one imaging exam frequently took the patient up to their deductible, and then the patient had no incentive to not go down the hall at the hospital for further care, but to go elsewhere into more affordable, high quality facilities. And so they decided to put green imaging in at zero out of pocket, or actually just imaging in at zero out of pocket. And there were several contenders. But the thing that we offered that the local networks, there were a couple of networks of, small chains of imaging centers, that had 2 or 3 locations for them. But the things that we offered, we did offer the same affordability, and we offered bundled pricing. Imaging centers don't always have bundled pricing. Frequently, it's some percentage of Medicare that they're offering, and that gets split out. And so contrast is charged, the professional fee is charged, the facility fee is charged, and those things have to be brought together to really understand what the pricing of the exam is. With us, you get one price, and it's a bundled price. They knew that we offered not only, just imaging centers, but basically they're getting their own team of radiologists. They're getting their own radiologists who are directly involved in the patient care. And so our company is actually completely radiologist owned and managed. And so what we do is we make sure that the quality of the imaging exams is great, that the customer service at the centers is great. If there's ever a question of image quality, most of the time for this district we're reading the studies, but if it's one where we're doing it in a network and it's read by another radiologist, if there's ever a question of quality, we can get in there and look at those images in the report and make sure that that the quality is there. We offered bilingual communication. We have a world-class world-class concierge service with, bilingual, and that was very important for these Floridians. And then we also had a much broader network, and that proved to be super important during the pandemic. So when we did these initial analytics for the district, we only took the four major, at that point in time, they had a mobile mammography solution. So we took, the other four major modalities that are done in an employer funded healthcare plan, and we estimated savings of $1.3 million for 2020. What we were actually able to do, though, was leverage those 10,000 members, go back in and negotiate better pricing in that geographic region because we had that highly aggregated group of members, and we were able to get the pricing down by about 20%. So, despite the pandemic in 2020, which really was very impactful on medical imaging, we had 50% capacity for about 3 months. It's back up to about 80% of expected exams right now. But there's been a tremendous impact on people going out and getting the care they need. And so, despite that economic and an emotional challenge of employees getting out there and getting that mammogram, we were actually able to save the district and its employees 1.5 million in 2020. And now we've gone back and looked at the trailing 12 months, September of last year through August of this year, we're up to 2.3 million in savings. And then going on to looking at what's going to happen in the rest of 2021, we're projecting at least 2.5 million in savings. But savings is those direct savings are a small part of this. The other things that are happening is this district wanted its employees to get care. Unlike some employers who come to me and say, well, if I give them zero out-of-pocket imaging, aren't they just going to get, imaging they don't need? Well, that really doesn't happen. I'm a radiologist who has owned imaging centers throughout my career. I can get a free MRI. I haven't had an MRI in 25 years. So no, people don't just go get imaging they don't need. But what this district, the hero story here is that this district wants its employees to get that care. They know that down the line, that's going to significantly impact the health of these employees and the cost of that care down the line. And so, we identify members with unaddressed health findings. So when I read a CT for School District of Osceola County, I'm completely saying this. I look at a CT, chest, abdomen, and pelvis. I'm looking, make sure the aorta isn't dilated, that there's not some kind of aortic valvular disease. I'm looking at the coronary arteries, making sure there's not coronary artery calcium there that would increase cardiovascular risk. Looking at the heart size, looking for emphysema, looking for interstitial lung disease. As we move down into the abdomen, we're looking for fatty liver. We're looking for atherosclerotic disease in other vessels that's advanced for age that would, suggest increased cardiovascular risk. We're looking for compression fractures in the spine that might indicate the patient has osteopenia or osteoporosis. So I'm not just looking for, the patient who comes in for belly pain. I'm not just looking at making sure they don't have appendicitis. I'm noting all of these under the diagnosis so these can be addressed back at the health center. Our medical management also takes on the fact that 40% of follow-up exams and imaging that are recommended never happen. And so, we're in a unique position here where we're working very closely with the health center, and we can go back to the patient and to the health center, or if it's an outside referring physician, we can go and get the order for the follow-up exam that was recommended. We know that those 40% of missed follow-ups, it's statistically proven that those have significant health consequences. So we calendar that patient's follow-up, and we get back with that patient and say, hey, you were recommended a 6-month follow-up mammogram and ultrasound. Let's get you scheduled for those. And we're tremendously impacting care by doing so. We've also been a resource for the patients who've opted out of the health plan, and for self-pay patients, somebody who might have other coverage in the district. And one of the things that's very interesting is we noticed that our net promoter score is 80, was 80 plus. and that's world class. But what I started noticing was, while people would give green imaging on how green imaging performed, 5 stars out of potential 5 stars, when they actually did the net promoter score question, which is, would you recommend us to friends and family, we were sometimes getting, fives out of 10 or 6 or 7, not that 9 or 10 that you need to get a great net promoter score. And so what we realized is that a lot of people think we just offer imaging within health plans, and we don't. About 20% of our business is individuals who need our care. And so we added, when we sent out the survey, we added, hey, remember, we have great self-pay pricing for your friends and family. And suddenly, over the last 7 days, we had our net promoter score was 100. We had 26 surveys come back, and all of them, either gave us a 9 or a 10 on would they refer us to the friends and family. So that's just an interesting story, but we're a great self-pay resource for those, even for those who are not participating in the health plan. I love it that they're steering members toward healthcare rather than away from it. One of the unintended consequences, and one of the things that's just been beautiful, is that these aggregated lives, and what happened additionally was that the Rosen Health Center saw that not only were we containing cost, which they already had in place, but we had great customer service. And so they added, their employees to this geographic aggregate of lives that we had there. And so suddenly we became the best referral source for these imaging centers. And we have imaging centers opening on Saturday and Sunday to take care of these employees. And that's just beautiful. And, we love working with the imaging centers there. Um, well, everybody's been watching the price of an MRI. CT prices had really increased dramatically in these Florida health systems. And so, really, we're providing almost 80% savings on the CT scans. Um, but as I go back, the savings is only one part of this. The part of it that's very, very important and forward thinking for this school district is that they're taking better care of their employees now, so that they have, decreased time away from work. They have better health, better energy. And so that the cost of care down the line, what we know is happening in the United States right now, is longevity is decreasing because people aren't getting the care they need. Part of that is because of the pandemic, but yeah, and because of the psychological impacts of the pandemic. But it's also because people are delaying care. And so I just, my hat is off to the school district for having so much foresight and taking such great care of its employees.